Hi, I'm Mike Manzo from Atlantic Physical Therapy Center. Today we're going to talk about a new technique that we're using here at Atlantic. All the techniques that we currently have been employing in physical therapy tend to be compressive in nature. Massage or joint mobilizations, they're all compressing down into the tissue. What we're doing with myofascial decompression is actually pulling up on the tissue. And the tissue that we're really targeting beyond the skin is the fascia. And fascia, when I went to school, we kind of just wanted to get through the fascia in gross anatomy so that we could get down to what we considered the good stuff, the muscles and the nerves and ligaments and all that. But research more recently is indicating that it's kind of all about fascia. This fascia is not just this inert casing like a sausage casing. It's more contractile and it's got nerve innervation, and it really helps with stability and with our movement. So this technique, using these little cups, we're able to kind of impart a decompressive force through the skin onto the fascia and then create movement. There's different indications for this. We use this with trigger points to try and help inhibit that trigger point. There's other times where a muscle is just hyperactive and we can use these as a means to try and kind of inhibit that active muscle contraction. We can use it to try and facilitate muscle contraction. If somebody's posturally positioned incorrectly, we can kind of target a certain muscle and then pull them back into the right position and then enable them to exercise from the more correct position. And the most effective technique that we're using with these decompressors is when we want to mobilize soft tissue. So if someone's really tight in a certain area and their body's perceiving the stretch too early in the movement, we can put these on the tissue, and then we can either place them along the tissue that we're targeting and then go through stretching techniques with the person, or we can put these on and then glide them along, and the tissue will pick up and continue to pick up through the cup as we move along that tissue. And it's just a really effective way to mobilize tissue that you can't get when you're pressing down into the tissue. So now you know a new technique that we're using here at Atlantic Physical Therapy Center. But this is just another tool in our physical therapy toolbox. This isn't the right technique for everybody. This is for very specific conditions. And the principles of good physical therapy, helping someone move correctly, looking at their biomechanics, making them stronger, mobilizing what's too tight, all of those things still apply. To get some more information about this or any of our centers, go to www.atlanticptcenter.com.